On the health front, we're expecting the biggest overhaul of Medicare in 4 decades.
Even before the National Cabinet on Friday, where Premiers received the report of the Medicare Task Force and committed to reform of the system, including allowing nurses and other health practitioners to be subject to Medicare, New South Wales Premier Dominic Perrottet was saying he did not expect any further funding at the meeting in an interview with Sky News.
Funding shouldn't be a roadblock. Let's start with the best policy possible. So whether that investment in telehealth, once again largely in the federal government space, but we're doing a lot of work there as well. Pharmacy reform, which is occurring in Queensland and New South Wales, I think that should go nationwide. And also that better integration between GPs. And I'm more than happy to continue to invest in those urgent care clinics to ensure there is less pressure on the public health system. So I'm not going down to Canberra on Friday asking for funding. I'm asking for a better health system.
So there will need to be money in the federal budget to implement this new system, and more than the $750 million promised at election time. But the PM was never going to stump up now in the context of a New South Wales election campaign as opposed to his budget process. One interesting element of this reform, which has been largely missed, is the employment of former top New South Wales public servant Robin Kruk to find more ways to ensure GPs' qualifications are acknowledged. Ms Kruk is seeking, as it was put to me, to find ways to have foreign-trained doctors now working as Uber drivers and the like into the workforce, to have their qualifications recognised. 14% of medical graduates are becoming GPs. The government wants to lift that rate, and there are more law schools around than medical schools, and the government wants to look at that as well. The PM certainly upped the stakes on Friday on this health reform of the 40-year-old Medicare system, saying it is the #1 priority for the National Cabinet this year.
On health reform, the National Cabinet has agreed that this is the first priority issue for 2023.